Hey guys, my name is Jennifer and I'm coming to you from ABC Medical. I'm the CEO and I'm here to talk to you about Epic, our new electronic health record system that we're going to be having coming live to us in the next month. So we have been working diligently with this system for the last several months, kind of behind the scenes for you guys, working on building the system, integrating the system how we want it, as well as online training for our managers and our departmental staff, as well, the important key people, so that when we do go live in the next month, we're going to be able to better assist everyone department wise for each one-on-one where you work versus trying to have everyone trained collectively on the whole system. So we have been working on this for a little bit, but I do want to come to you guys and talk to you a little bit about what the advantage of coming to this system is going to be versus our older system, McKesson, and versus what we've been doing. So the advantages of having this system is we have the ability to access our patient data readily available. So any patient that anywhere using a cloud-based program makes it easier for them to access patient records. Allows the physicians and the nurses to do their jobs easier. So on-call patient physician calls and they can collaborate. He can pull up any records from our new chart when a patient calls at 1 a.m. in the morning. When he's talking to them on the phone, he can pull them up on his computer. He doesn't have to go in, see the patient. He doesn't have to go to the office to pull the chart. He's going to be able to pull that up right there at his home. So that's going to be very accessibly ready, available for him to do so. Also, too, another example is going to be if he's rounding on a patient, which this is something that's already kind of been available anyway, using it if he on one floor and a patient's on another, he can put in orders. This one's going to be able to do those kind of things when they're not there, and also sending our much easier with our patients going to be able to send messages directly to their physician for care team, that kind of thing, for physician patient relationship as far as that goes. It's going to be much faster, easier response time. Those are going to be very compatible there. We also have a package to where we can be able to collaborate with our sister hospitals in our neighboring facility, doctor's offices, and like Greenville Hospital and that kind of thing, where if a patient has received treatment there within that system, we're going to be able to pull up those records as well. So if a patient has received labs or blood work there, or imaging or some kind of testing there, we're make sure that we're not duplicating that testing by ordering it again if they just had that last week, or we've already ruled that out at another facility. So that's going to be very nice to be able to improve your patient care with them. Being to improving efficiency for our EHR system, it's going to be able to completely manually saving time for office staff as far as pulling and storing, filing charts, that kind of thing. And that's the ability of sharing that data that I was talking about. When patients are needing to share the records, or they're seeing another specialist or something like that, we're going to be able to easily transfer records over, or send records for them a lot easier as opposed to the old-fashioned way. And that's going to make their smoother transition with them. We'll also be able to going to be able to do the pharmacy. It's very aggravating, I know, for a lot of physicians and staff to call the pharmacy and get on hold and wait through the whole automated system just to leave a message for a patient and not know if they got that message for a patient. So with this, all it is a couple clicks to send in a electronically prescription, and most of the time, by the time the patient gets there, it's going to be there and be in the process of being ready. So that's another perk of having this for both patient and doctor. So a little less fight in between, the cutting out the middleman there, and a lot easier on the staff and not having to answer other calls that are bogging down the system as far as on the physician's doctor's office side. Okay, alrighty, and then so we also have for our able to interaction, more engagement and interaction with our patients, we have a mobile MyChart activation that we have that's going to allow the patients to feel more in charge of their medical records, more in charge of their health. Okay, so this allows them either on a laptop, tablet, computer, even on their cell phone. They're going to have access to their records. They can pull up their labs, their diagnostic results. They can pull up their chart per se for the most part, as well as what medicines they're on, what medicines they've stopped, when their last immunization records are. And a lot of people, even people of our younger age, that doesn't know when that last immunization was. I know I don't. Okay, so this is going to be vital for a lot of people of all ages and very user friendly. Older elderly people are able to use this system, and it very well helps to keep them on track of what meds needs to be filled and when it needs to be filled and that kind of stuff. They can send just a message over saying that they need that medicine refilled, and the clinician from the doctor's office can just send a message over, say it's ready, I'll send it over, that kind of thing. A short, sweet, brief message, and just get it in and out and easier for everybody. Also, too, if there's a message or a question that a patient has, they can easily send it through MyChart. It's not an urgent request, but, concern or something like that. They can just type it up in MyChart, send it over before they go to bed. Then the physician or the nurse that's there, they can just give the patient a call or respond with a message. So that's, a lot of patients have gone to that MyChart. It's great for when they're traveling. They're able to resource to that if they need to. Knock on wood, for whatever reason, they can have that, especially when they're not here in their own areas, and they really like having that safety net for that reason. And then we, some of them also able to, which we're still working on this, but such devices like Fitbits and Apple Watches and track their progress, some for like diabetes and things like that, that can kind of progress with certain doctor's offices. And depending on the office, they may be able to do that if that particular doctor wishes to do that, and we have a couple that are interested in that. So if that's a particular thing that your office is wanting to do, then they'll go over that more with you in depth. Again, Epic as a whole for our system is going to be wonderful for as it is, but for individual department and department wise, you're going to be in tune to more specifically for that program, for that area that you're going to be working. So your billing is going to be a little bit more in depth in the billing aspect. Your x-rays are going to be more in the x-rays and so forth. So you're going to be kind of in different departments. We're not going to overflow you with an area that you don't need to really overflow your mind with, okay? But we're super excited about switching gears to this, and this is something where one patient, one chart, and one zone for everybody, one umbrella. So everybody working under the same goal and the same umbrella for everybody is really going to be a great shifting gears for our team. So I'm very excited about this, and if there's any other questions about our Epic team and anything, what we need to do to make anything better, and there will be a transitional phase, and I do understand that, and so there's going to be a lot of questions. There's going to be some things that are going to be some glitches in the system, as always, when we switch over to anything new. So just be patient with us. We will have our team, Epic team, live with us when we do go live along with the staff within your department that have been trained with Epic, and they're going to train to do your department specific things. But any further questions, any things, any other mind things that you want to change, feel free to let your department managers know, and they will let us know. We can work on getting that to be switched. Okay? All right, guys. If y'all have anything else, feel free to let me know. Email me or call me at any of these numbers or email below. Okay? All right. Thank y'all so much.